Welcome, boys and girls, to our next episode of Viruses in Pajamas. Leading this discussion tonight is Dr. Emily Messina, and I'm here to talk to you about polio and enteroviruses. Yeah, I know it's late at night, and my brain is going to strange places right now. So we're going to go on a fun adventure, caffeine-induced journey through enteroviruses, in particular poliovirus. So, the bullet points, the overview of enteroviruses. Entero means gut, right? So all of these viruses are going to have a gut tropism. Hold on a second. Okay, I think I fixed my tablet and pen. Alright, so these enteroviruses primarily replicate in the gut. Now, that's not to say they can't cause other symptoms elsewhere in the body. They can become systemic, but they have tropism for tissues in the intestines, and they're also spread fecal-orally. Now, these viruses are naked. They are icosahedral. And I just wanted to mention here, when I was looking on a later slide for pictures of the structure of enteroviruses or polioviruses, and I just did a Google image search. I know that's super duper scientific. There were multiple pictures that popped up that showed poliovirus or enterovirus with an envelope, which is incorrect. They are naked. Alright, so they're also small, like we all come into the world small and naked. So how small? About 30 nanometers. Pretty tiny. They have a relatively small genome too, 7.4 kilobases. So there are many different enteroviruses. The one we've studied the most is poliovirus, and this is the most famous. But there's several polioviruses, and many of them can cause disease. We have Coxsackie viruses, echoviruses, and then just random numbered echoviruses. They're not really random, they're just ordered in the number that they were discovered. Now, Coxsackie, I think, is named after a location where a particular strain was found. I honestly don't know why echoviruses are called echoviruses. But Coxsackie viruses and echoviruses and enteroviruses can cause a variety of diseases. In particular, they're known for causing hand, foot, and mouth disease. We'll talk about that a little bit later. They can also cause heart infections. My mother-in-law actually had a heart infection with a Coxsackie virus. She thought she was having a heart attack, so she decided, instead of calling 911, she was going to get in her car and drive to the hospital that she preferred. Yeah, many things wrong with that. We're not going to unpack that now. Now, most infections with enteroviruses, I should emphasize this now, they are mild or not severe, right? So most of these infections aren't that bad. However, when the infection spreads beyond the initial site of infection, viremia would be viruses in the blood. So when this can spread systemically or to other tissues, it can be very, very severe or fatal illness. So in all told, out of the 5 to 10 million infections every year, between 30 and 50,000 result in hospitalization. This is in the United States. Unlike a lot of other viruses, these viruses stay in your system and they're shed for a really long time. So from the time you get infected to when everything's all said and done and an acute illness, you can be shedding virus for up to 6 weeks or so. Now, also of note, some of these viruses, right, cause a common cold, right, mild infection. But when these viruses, even the ones that cause hand, foot, and mouth disease, occasionally can have severe complications. Occasionally, they can lead to encephalitis or meningitis. Now, of course, the most famous one is polio. There's 3 different strains of polio. Polio is famous for causing paralysis, and we're going to spend most of the lecture now talking about that. Okay, So why are we talking about poliovirus? Well, because it's a really, really scary virus, and we're lucky that we have a vaccine. So a couple things. Until recently, we didn't have a lot of the technology and the science to really understand polio and how it spread and why it does the things that it does. So a couple things that were unusual was you would get sick in the summer, like a lot of colds and flu, right? You get sick in the winter. This is something that came seasonally in the summer. So you had the summer cold or the summer illness, summer fever. And we know that this has been infecting people since ancient Egypt, but we haven't seen a lot of, or I should say, there haven't been a lot of documented widespread outbreaks until the 1800s. And then since the 1800s, it's become a big problem with lots of people getting infected and lots of people getting paralyzed. When I say paralyzed, it's important that we note it's a flaccid paralysis. So when you get tetanus, for example, you lock up really tight. A flaccid paralysis means you're droopy, right? You can't contract your muscles. And this often starts at the feet, and it works its way up. And when it gets to your diaphragm, then your lungs can't work for you. Your lungs can't breathe. And then you either die, you suffocate, or you're put into an iron lung, and you're in an iron lung for a few months, years, or possibly the rest of your life. That's my son. All right, kids are asleep now, so no more interruptions. Moving on. Let's look at how polio infects and what the course of infection is. So, again, to stress, like most enteroviruses, most polio infections are mild or asymptomatic. Now, that doesn't mean they're not infectious. Asymptomatic people can still be very infectious. This is a particular problem. Kids still in diapers, or just really any small children, because children are adorable, but they're adorable vectors of disease and pestilence. Anything that spreads fecal orally, kids are going to have a hand in spreading it. Also, overworked daycare employees and so forth and so on. Now, some cases, and this ranges depending on the strain of the virus, but between 4 and 8% are going to have a mild illness. It's still not going to be fun. They're going to have a fever, sore throat. You get this like flu-like illness, because everything causes flu-like symptoms. But sore throat, fever, you feel pretty bad. You might have some diarrhea, cramping. Most people recover from this within a week or so. But some people who have the mild infection then go on to develop paralysis. And this is 1% or less of all polio infections, but we have to think about if you get enough people infected, that's a whole lot of people that get paralyzed or die. So one of the worst years we had, 1916, 6,000 people in just the United States died over the course of the summer, and 27,000 were paralyzed in one summer. If you think about the mortality rate of COVID-19 that we're going through now, it's relatively low for younger people, but anyone who's immunocompromised, we're a little bit higher, still not super high, but again, if you get enough people infected, then you get a lot of people really, really sick. And so this would happen every summer. People would be living in fear. The summer fever would come around, and tens of thousands of people would be paralyzed every year. So this was a really, really scary thing. So let's take a look at the nature of that paralysis. So paralysis in polio is very characteristic. It's a flaccid paralysis that affects often the lower limbs first, and it causes muscle atrophy, and it causes one of the symptomatic things is the floppy foot or kind of pointed foot, like you're unable to flex your feet, and that's what's shown in the picture here. Now, paralysis, depending on the type of paralysis, we've got 3 types. Oops. We've got 3 types. We've got the spinal paralysis, where this is often asymptomatic, and so that's also shown in the picture here, where this leg looks okay and this side is suffering from the paralysis. This is when you've got polio infection in the lower spine. Here the bulbar is in the upper spine, and this leads to more muscle weakness and inability to talk or swallow, or you can have a combination of the two. Now, if this affects your diaphragm, then you're unable to breathe, and so they put people in these iron lungs. And so this is a type of respirator where it's a sealed chamber, your whole body goes inside, just your head sticks out here, and you could be in this iron lung for weeks, months, or your entire life. And you're able to, well, if you're able to speak, you can speak. If you're able to swallow and so forth, so you can have your head out, you can theoretically interact with people, and then this changes the pressure, and it actually forces, instead of forcing your lungs open, like if they put a tube, if they intubated you and they're pushing air into your lungs, here they're actually changing the pressure in the chamber so your lungs can more naturally inflate and then deflate. And this is more comfortable if you have to be in the respirator for a really long period of time. Now, for those who get paralysis, 80% of the time the paralysis is permanent. 10% of the time they die, and 10% of the people with paralysis do manage to recover, but that recovery is sometimes incomplete, and sometimes you feel like you're recovered, you know, you're walking again and so forth, but then years later you get post-polio myelitis syndrome. And so this can occur between 15 and 70 years later, so on average 36. And all of the tissues that were affected, where you had paralysis before when you were had the acute infection, those muscles begin to get weak now. They atrophy, and this can kind of come and go a little bit. So you can start to get weakness again, you get pain, and then you start to feel a little bit better, and then it comes back, and this can last for quite a long time. And unfortunately, they don't really know why this happens in some people, and they also don't have a real good cure. In fact, there are no good antivirals for polio. There's only supportive care. What they found to be effective or moderately effective to at least improve the quality of life in folks with PPS is a combination of physical therapy and occupational therapy. So this is spread fecal-orally. So the mouth is the portal of entry. And again, children, particularly children in diapers, are really good at spreading this because children are vectors of disease and pestilence. Quite a long incubation period, and you can be infectious for part of that incubation period. And this infection stays with you a while, so you are spreading the virus for a number of weeks, even after your symptoms have gone away. So the structure of poliovirus. We'll pick up here. I'll try to keep these videos short, so we'll pick up here in the next segment of the video, of the lecture.